Good afternoon, everyone. And I'm joined here today, Dr. Alexander Scott, Stephen Pryor with Commerce, and Tom McCarthy, Executive Director of the state's COVID response. So we have some positive updates today to share and continued challenges this year. So I'd like to start by giving an update on the Rhode Island's vaccine distribution rating from Harvard University. Getting shots into people's arms quickly and building out Rhode Island's vaccination capacity has been one of our top priorities. And we've been focused on this not only for the last 23 days, but also during the time that I was incoming governor. One of the first significant moves that we made was to get the inventory off the shelves, and with the help of the general and our municipal leaders, we were able to do that. I'm glad to say that Harvard University upgraded Rhode Island's rating vaccine distribution from an F, and they gave us in early February to a B today, and we're going to continue to help improve that grade across any metrics that are out there that we're being measured by. It's good news for people in Rhode Island. They should be encouraged by the progress that our state has made, and I thank Dr. Alexander Scott and the COVID response team who worked with us to speed up this distribution. Today, Rhode Island is approaching the milestone of 500,000 shots in arms, and we've come a long way, and we're committed to keep this momentum going. To give you an idea where we stand right now, Rhode Island has the capacity to administer 100,000 shots per week, and next week we have the capacity to do 160,000 doses per week. This week we received 53,000 doses. That's up from 47,000 last week. That's great news. Dr. Alexander Scott and I were on a call with the White House this week, and we feel as though that the volume and the supply is going to continue to increase, and that's great news. In the meantime, we continue to build out our capacity, ensure that we're ready to get shots in the arms when additional supply arrives. Next, I'd like to provide an update on Rhode Island's vaccine eligibility timeline. Last week, we announced that Rhode Island would open up vaccine eligibility to ages 16 and over starting April 19th, and we remain on track on that date. Over the last week, our team has put together an accelerated eligibility timeline to ensure that vaccination appointments will gradually open up to different age groups ahead of April 19th. And in a moment, Dr. Alexander Scott will provide us with the details. I'm also glad to announce 2 additional state-run vaccination sites that will be opening soon as part of our effort to prepare for an increase in vaccine supply. The site in South County at the Schneider Electric facility will open this Saturday, March 27th at 132 Fairgrounds Roads in West Kingstown, with 400 doses available. And Woonsocket site will open up this Sunday, March 28th, at the old Sears building at 1500 Diamond Hill Road, with 400 doses available. Appointments for these clinics will go online on Friday at 5 p.m. at vaccinateri.org. As our vaccine supply increases, more appointments will become available at these sites and others, and we're working hard every day to make sure that we can make vaccines more and more accessible to all communities in the state, and where we're falling behind, we will have a plan to catch up with any community that is falling behind. We also have an update on the vaccine pre-registration notification system. Tom McCarthy is going to walk us through some good news on the front. Rhode Islanders will be able to pre-register to be notified when a vaccination appointment becomes available to them. And Tom will give the details on that when he presents. The system will prioritize individuals based on age and underlying health conditions. Next, I'd like to talk about local businesses. Every week, our team sits down and evaluates what we can do to safely give our businesses more flexibility. I'm going to continue to make good on that promise, and that we will make incremental progress on this front as long as the public health data holds and we continue to get increases in supply from the federal government. Today, there are a handful of changes that Secretary Pryor will announce related to self-service seating at restaurants, daily cleaning protocols, and table size events at restaurants. We want to keep the lines of communications open between our team and the small business community, and that was important to me as Lieutenant Governor and continues to be important to me today. Finally, I'd like to highlight some good news related to the child care providers that was shared earlier this week. The Rhode Island Department of Human Services announced that they will be using federal coronavirus relief dollars to provide close to $20 million in support to child care providers starting in April through child care stabilization grants. Licensed child care providers can apply for grants ranging from $3,000 to $50,000 per site, and child care providers can apply at kids.ri.gov. Next, we'll be back with some additional updates on K through 12 and child care, which is being made possible by acceleration of our teachers' vaccination and related staff in both the K through 12 and the child care. So on a personal note, you might have seen, but my wife Susan and I did receive our second shot at the Dunkin' Donuts Center on Tuesday. And I want to thank the team at the Dunk and General Callahan, along with the Rhode Island National Guard, who made the process quick and easy. And I met with many people who live in the state of Rhode Island that were just so thankful that how smooth it was, and it didn't hurt. I still got my Band-Aid on my arm, but I'm doing very well. So no one has to be fearful about getting their first or second shot. And I want to make sure that people understand that it's so important that we get vaccinated. And as we work out to build our vaccination capacity and prepare for an increase in supply, we continue to encourage Rhode Islanders to get vaccinated once they are eligible. Final message is we're still in where we need discipline. We need to continue the discipline in terms of the protocols that have kept you safe up to this point in time as you wait for your vaccination. We encourage this strongly, that we continue to have the discipline of wearing masks, social distancing, and limit your interactions with others where possible. It also means getting a shot when you're eligible for a vaccine.